I think the community is very comfortable, very common with what a general medical ED does and treats. But what we've found in our community is that folks aren't quite sure where to go for a psychiatric illness or a substance use disorder or any mental health or behavioral health treatment. And really that's the population that we cater to. So we want to cater to the patients who do not have an acute medical illness, but really need some additional help and support. So we've created this calm environment that we're staffed 24/7 with behavioral health experts. We have psychiatric mental health nurse practitioners, as well as therapists, psychiatric technicians, RNs, LPNs, really here to help the immediate needs of that individual.
If you go to the main hospital, that's a medical emergency room. There they can treat anything from cuts all the way up to heart attacks or car accidents. In the psychiatric emergency room, we'll treat minor medical conditions or minor medical ailments, but our focus is going to be on mental health, on psychiatric conditions. So if somebody is having a psychotic break or they've used drugs, we can treat people here for those things. Depression, anxiety, bipolar disorder, we can treat kids and adults here for those conditions. So the main thing that we're going to focus on here is mental health and psychiatric conditions.
The Psychiatric Emergency Department at Riverside Mental Health and Recovery Center has designated treatment areas for both adults and pediatrics. So our adult area will treat anyone over the age of 18, and our pediatric area, anyone from 5 until their 18th birthday. When you arrive at our facility, you can expect to be greeted by either a patient access rep or another team member. At that point in time, we'll get your name, hear a little bit about what's going on with you, make sure there's no imminent risk to you or others as we start to walk through our process. We'll then bring you to our triage room. We'll make sure there's no major medical concerns going on. We'll hear a little bit more about what's been going on with you, what your history is, and then we'll bring you back to our unit where we'll start to talk a little bit more about what is best for your treatment plan.
You'll either be placed in a room at that point, or you will be placed in one of those recliner models, and you'll be seen by a therapist. You'll be evaluated by a nurse practitioner or a physician's assistant, or possibly one of the psychiatrists here. And then we'll make that decision with you from there if you need to go into a psychiatric facility, or if you can discharge home with follow-up care outside of the hospital.
For our younger population, folks under the age of 18, a parent, loved one, guardian is really able to stay with that patient through the entire emergency department visit. We really think that that can create some comfort and stability.
We do have outdoor areas, so people can go outside and get a little bit of fresh air if needed. We also have sensory rooms. Those are rooms where if somebody needs to, of course, go to an area where they need to calm, they can use that. It'll actually have a screen that'll show different scenery, different sounds. It can actually play music in that area as well. You can dim the lights. It's a nice area to sit in.
There's additional opportunity for de-escalation as well. There's a fan, there's some white noise to really start to calm and relax folks so they can begin to self-regulate and really be more open to treatment at that point in time.
We want this community to become stronger, to unite more behind mental health. We want to get rid of the stigma of mental health, so we're moving in that direction. And we want to help everybody that we can. So even if you're from outside of the area, a family member comes in and they're from outside of the area, you can bring them here and we'll treat them as best as we can.